My background is in public health. My undergraduate degree is sociology. I come at my work from a community organizing standpoint with a focus on social justice. Early on in my childhood, I had an African American friend who died of a burst appendix. And when I asked my mother why our family doctor couldn't save her, her reply was that he was not able to treat her in the black hospital and she was not able to go to the white hospital. I didn't understand that was called health inequities at the time, but I've come to understand that. And so at this point, as a public health researcher, I'm very interested in trying to do something about, bring about change to address the health inequities that exist in this country, and particularly in the city of Detroit. I come at research from a particular approach to research, what we refer to as community-based participatory research. And what CBPR is, it's a partnership approach to research. It engages community entities along with academic researchers in trying to address issues that communities have and are concerned about related to their health. And there's a number of issues that have been identified by our community partners. These include access to health care, quality of care. They include diabetes management and prevention. They include exposure to air pollution and the impact of that on childhood asthma. The specific issue comes from the community context, but what's really important is that approach to research. We as researchers come with expertise on how to conduct research, but our community partners know what's culturally appropriate, what's going to be viable in the community, what are the issues and concerns of community members. I'm trying to identify the most important issues. The way I approach it is looking at what are the risk factors and the social determinants of health, the environmental determinants of health that impact across multiple issues. How do we as public health persons think about health in all policies, recognizing again that transportation has an impact on health. If folks don't have transportation, can't get to jobs, that's going to have an impact on their health. So those are the kinds of issues that I think are most pressing and we need to address. There's a long history and support for interdisciplinary work and collaborative work on this campus. I often talk to former students or former faculty colleagues who go on to other institutions, and one of the comments they say is, it's just not nearly as collaborative as U of M is. It's harder to do interdisciplinary work. It's harder to meet your colleagues across campus and do this kind of work. So I think having that climate and having that context and a long history just made the university ripe for setting up IHPI. I became a member of the Institute because I really value the mission that IHPI has. I also value the approach to collaborative research and bringing people together from an interdisciplinary standpoint. The recognition that no one researcher is going to be able to address the complexity of problems that are faced related to health, and that it's going to be through bringing people together, working together, that we're going to be more effective in our research and our action. There's more and more recognition of this importance of social determinants of health. Yes, healthcare is important. Yes, genes are important, but that we also need to think about the broader social environment and how that impacts health status. I think there's greater opportunity moving forward to look at public health from a socio-ecological model, which recognizes that individuals are embedded within larger social systems. How do we engage in more of these kinds of interventions and policy change to address these social determinants of health that are having such an impact on health status?